And this is The Conduit. All right, y'all. It is Wednesday. I think everybody might need a horn today. It's 3 o'clock in the afternoon. April showers bring May flowers. Weather's been a little bit crazy, but it's Wednesday. Bremerton Housing Authority. It's KCR. Today. Katie, how you doing today?
I'm doing good. The music is a lot louder than your voice for me, but there's also some background noise I have in my new office. I'm now at the 600 Park building at the Bremerton Housing Authority, so that's exciting.
Awesome. Jill, how you doing today?
Good, doing great. We're happy to have Katie here with us at our office now. Now she can't get away.
That's fantastic. Dad, how are you doing?
I'm doing good. I know, Katie, you were like in different modes of weren't you in a boat sometimes? Like,
there was a point I live on a sailboat still. That hasn't changed, but
That is
yes,
awesome.
I'm a little further from it. But I like to commute via my feet, so I will still do that, especially when it's nice outside. So.
Awesome. Well, and we also have Kirsten Jewell joining us today. Kirsten, how you doing?
I'm doing great. Sorry to be late. We're dealing with a couple of urgent things right now, so I apologize. Tried to wrap up, but here I am.
Oh, no, that's okay. I didn't see your email. This is the first time I've looked at email today, and I saw your response. I'm like, I hope she gets this. So I'm so glad that you got it. And
Happy to be here.
We got a full house today, so this is awesome. We've got a great discussion set up for you. And Layla is here today. Say hello to everyone, Layla. So as you know, it is spring break. But I just wanted to let everyone know that we do have a giveaway going on right now. One entry for every live share of the show until Friday. And we will pick 2 winners, and someone will win a Best Buy card, an Amazon card, a Starbucks card, or one of the Conduit candles. Would you like to show off the Conduit candles, my lady? All right, show them to the camera there. All right, so these are handcrafted with love. Show the big one. So there'll be bigger candles if you win the candle. Probably that size or a little bit smaller, not the little decorative things that go on top. But we're working out the kinks and working out the bugs. I know, Katie, you're excited to have your little one join us in some candle making. So we're figuring it all out right now.
Yeah, that would be really fun. Actually, you talk about spring break. My kids are lucky. They went to Defy, which is the trampoline park today, and they went bowling after. So they're having a fun time, even though I'm here at work. So I'm happy about that.
Well, that is Layla's favorite spot. She was there yesterday at Defy. So our kids will probably bump into each other at some point in time.
Yeah.
Well, let's go ahead and get into the show. Kirsten, we'll kind of go first so you can kind of see what the format looks like. Basically, we just kind of go through updates and kind of have discussions centered around housing, and we just kind of go from there. So, Matt, how about you start today? We always leave you last because you have so much to unpack.
Yeah. Should we start with some numbers?
I love numbers.
It's the beginning of the month, so we'll kind of talk about how we did with March, and so got some really good news and some not so great news. So we'll start with the bad news. So our wait list for first rounds, which is the one that we're really we're really trying to make progress on. We're still actually going the wrong way. So it was 510 last month. It's now 531. And that's despite having a really big month. So like I've said kind of in past, we've kind of given up the kind of goal of getting to functional 0 because we just seem to be getting so many applications added. So we're just processing as fast as we can. And then we're using our legal partners to still swoop up the urgent cases. But the good news is that we had one of our best months ever. So, and remember, these numbers are unduplicated. This is just kind of a raw application total of They include utilities, rent. So it's just kind of a marker of how fast we're processing. They still have to get through our fiscal, and then the county gets those a little bit later. So these are just kind of our team's numbers. So for context, in December, we processed 180. January, we processed 218. In February, we slipped back down to 172. And then in March, we processed 291. So almost 300.
Oh, that's huge.
Yeah, it's more. We sent more than $2.3 million to our fiscal office this month. Yeah, so again, it takes a little bit to filter through and actually get out to the community, right? Sometimes there might be an error that got to kick back and whatnot, but as just kind of a function of how fast we're processing, we met our goal. Our goal as of January was to get above the 2 million mark. So we're really, really happy with how the team performed this month, and our goal now is to stay above the 2 million, and then hopefully maybe we can get to 2.5 million of just applications that we sent up. And so the breakdown, because we're still prioritizing our really trying to get through that wait list. So 149. So we did 149 applications from our wait list, 84 for the legal, and 54 for the buy and for. So that's kind of how our broad distribution for March. So the buy and for still have that priority pathway in order to get applications processed so we can meet our racial equity goals. Our legal went up, so we're curious to see if this is just a bump. Our legal have been a little bit lower than we thought, but that bumped up a little bit too. And especially as more folks getting notices, we think that might bump up even more. And we're really happy with 149. Oh, what's that, Marwan?
When you said legal bumped up, you mean that there's been more residents that are getting eviction notices?
Yeah, so these are folks that actually have a notice or are already in the process of mediation or already have a lawyer through Kitsap Legal Services, or even the courts know about it. So any of those legal partners, Northwest Justice, Kitsap Legal Services, or Dispute Resolution Center can refer in order to get priority access. And so we also have worked out with Dispute Resolution Center is the 14-day notices with their blessing. Sometimes they don't even need to have to go to Dispute Resolution Center because they're just going to go there anyways to just get a referral. So we've started to process some of those folks to try to be a little bit more efficient and take some load off of them. So it's really anyone, even at the very beginning, we're processing those folks. So yeah, any questions about that?
There is actually. The question is, are you seeing the average wait time on the wait list go down? We understand that the awesome work that the KCR team is processing more apps than ever before, but with more people being added to the list, at least the wait time.
No, the wait time is actually been somewhat static, much to our disappointment, and that's really a function of. It's really a function of that backlog of really starting with December and getting that flood of applications. And we'd be a little better off because we're kind of meeting some of the demand now. But that period of when we were ramping up in November, December, and January, we finally had that breakout month. But that fall and that kind of winter, November, December, we really kind of had a backlog. So we're still chewing through that. I hope that it'll shrink down, that we can get it closer to 2 months, but we're still seeing wait times from start to finish of about 3 months. And so I wish I had better news on that, but no, it's typically about that right now. Now, as we kind of chew through that chunk, and if we stay around this rate, I hope that will come down, but we haven't seen that yet.
All right.
That's a good question. Now, again, the wait time only applies to folks that are waiting from start to finish. Now, it's a lot faster for folks that are referred through a buy and for or a legal, right? That are in the event because they effectively skip the wait line because we prioritize them because of the urgency of the case. So those folks are not having that. So those cases can move, sometimes under a few weeks from start to finish, depending on the case and how complex it is.
when you were saying that the numbers have increased for legal, do you have a percent or a number differentiation there?
Yeah, let me go back. And so our legal in February was 45, and in January it was 66, and then in December it was 38. So what we thought was happening, December was 38, January was 66. We thought it was just going to keep rising, but then February it dropped to 45. So that's why I was really surprised, because everything we kind of been hearing is that number should be increasing. So it did increase in March. So I'll be really curious what April does. Was February just kind of a weird month, because we are back up in the 80s now, and so we're definitely higher than, that's our biggest month for legal. So it'll be curious if it's going to oscillate like that or just keep going up. We expected it to keep going up, but with the January or February data point of actually dipping down, I'm not counting the chickens before they're hatched. So we'll kind of see what happens.
Absolutely. Do you happen to know what the typical numbers of eviction per month are, pre-COVID?
I think we looked those up on, I think I found a website where we looked at those up, and they were like 2016 numbers. I can try to find that again to see what some of the rates were. I think it was kind of a project that did some research, but I can maybe try to pull those up a little bit later. Now, again, the numbers that I'm bringing up here are folks that are actually not getting evicted, right? So they wouldn't come up in any court documents. Some of the lawyers might have started in some cases, but most of the time we're catching them before lawyers and get involved, which is, kind of the ideal of the system, is to get to them before, right? The legal system has to, do a bunch of work and go through that trauma for the clients and, get judges involved. So these folks wouldn't come up anywhere. And so that's why it's kind of a little bit of apples and oranges comparison of the eviction rate. But I would love to, maybe that's something our KEPA partners we can look at to see if the eviction rate actually is increasing from pre-COVID times. I would be really curious. I don't know, Kirsten, if you have any thoughts on that or any information.
Like you, I could go and try to pull some numbers up from pre-COVID. I think Kurt Weiss, actually the former executive director of Bremerton Housing Authority, had pulled to some eviction numbers at one point. I could go back and try to find those. I think, as Matt said, we're really in a wait and see posture around what's happening with evictions. We've been having a kind of eviction planning preparation group meeting for the last year or so, every 2 weeks, with the Legal Aid, Kitsap Legal Services, Northwest Justice Project, Dispute Resolution Center, KCR, Superior Court, like all just trying to make sure we're clear about what's happening with evictions and processes. One thing I do know is that the Kitsap Legal Services has not seen an uptake in requests for their assistance with eviction cases. And then the Dispute Resolution Centers also has quite a high volume of cases that they're working through. So the new eviction process is that if it's a non-payment issue, then it has to go through Dispute Resolution Center process first. And then once they've certified that either that process resolved the situation or they made a good faith attempt, and then it can go forward with the eviction process through the court system. So one thing that might be happening a little bit is that there's a bunch of cases sort of bottlenecked at the Dispute Resolution Center stage of process, where they have to go through that dispute resolution process before they can get permission to continue on with the court system eviction process. So that's one thing that we might be seeing. The other thing is that, in some cases, this KEPA assistance is helping keep people housed, and that is preventing eviction, at least for the short term. Although we do know that there's people who are still struggling to make enough money to pay the rent.
Gotcha. We have a question in the chat. Hello, I was taking a look at the KEPA application and noticed community members are not asked if they are a veteran unless I overlooked it. is it possible to add that question and possibly add ROI between CCS and KCR? If so, my program, SSVF, and teams have capacity and funding to assist KCR with assisting veterans with back rent. I've been working with Gary, of course, but the veterans that aren't literally homeless, we tend to miss when they go to KCR as they are not put on the veterans master list because they are not homeless. I think this one is for you, Matt.
Yeah, no, that's a great question, Christina. It's something that we, Gary and I just had a meeting about today, and I believe we're meeting with the SSVS team on Friday to talk about this. So, yeah, we just kind of became aware of that fund. Our original goal when we made the KEEP application was to make it as simple as possible, and since we didn't necessarily have a veteran's preference or necessarily a reason to, that's why we didn't put it on there, because we were trying to make it simple. But that's something that we're definitely looking at going forward, and very open to the possibility of putting that. I think the easiest thing we can do is just train our navigators. So because we have a bunch of people right now that are already in the system, and that would be a lot of work to get ROIs for, but they eventually will talk with a navigator. And so I think that's the easiest thing in kind of short-term plans. We can talk with the navigator, see if they're a veteran, and then refer over to the SSVF program. I think I'm saying that right, in order to get additional funds. And then going forward, we can try to look at maybe some additional screening or even just information when folks apply to us. Maybe on our website we can have that information so that folks can call on their own. So there's a variety of options we're looking at of how to integrate, but I'm definitely excited to figure out how to do that better. And that's awesome that the SSVF program has additional funds for rent assistance. That's great for the community, for veterans.
Absolutely. So do you have more, or do you want me to move on to BHA?
Oh gosh, yeah, we've got a bunch, but I'll keep it hopefully concise. Yeah, so that's the big update for the RAP team. I just want to continue to announce for our housing team that the rapid rehousing program is open. We have move-in costs. We have our 6-month program, and we are really at our case management capacity right now. We are going to be expanding that as we're training more newer case managers. But if you are a partner agency and are helping someone look for housing and they are homeless, we have funds. So I'm definitely wanting to spread the word that we have that program open. The challenge right now, as for everyone, is finding the places, right? The funds are there. We can process paperwork. That's a little easier for us, but it's the bandwidth of we have a lot more folks. We've really doubled, and pretty soon here we'll triple the number of folks that we're actively working with looking for housing. But that is definitely something that for partner agencies or for folks, if you're working with people that are experiencing homelessness, much like the emergency housing voucher program had a bunch of partners helping. We hope to replicate some of that success, and going forward with the rapid rehousing program. Yeah, and then before we move on, I did want to talk quickly about the hotel program. We've been getting a lot of questions, and this is something that is a little complex. And so I know in the county has done great work at getting and expediting funds for hotels as we've slowly expanded. But I think there definitely is a little bit of confusion out there. So I wanted to talk a little bit about the hotels going forward. So traditionally, the grants do have some flexibility. Our CHG grant has some flexibility when it comes to hotels. However, in past, when we've had really constrained budgets, we shied away from using hotels because they're very expensive. And we've only used them in really dire situations of actively fleeing domestic violence, and folks had an end, kind of, right? They had housing lined up, they had a Section 8 voucher, and we're just waiting for a place. So we really started with hotels with a very narrow kind of focus. That has slowly expanded, one, as rapid rehousing is expanded, but also because of the vacancy issue in the pandemic kind of era. And so what we've done is we started in small cases with our high barrier folks. So that's what we started, the folks that really have trouble finding housing, of using some hotels to stabilize. And these are folks part of our 1/10, our ROAST program, that does high intensity case management. We have case managers on site 3, sometimes 4 times a week, working with these clients. And so that's where we kind of started. We're really going to continue with the hotels. And I know there's been some advertisement, which is great, but I think we're kind of focusing on those folks that have been chronically homeless, coming from encampments. It's not necessarily for a standard option for everyone. One, because there still is limited funds with hotels. We are going to be expanding, but really in the area of that chronically homeless. Now, we still can use especially for bridges, we're still very open to that if people have Section 8 or have another option kind of lined up. But I don't want the message to get out there that, KCR will put anyone in a hotel, because there's still a huge need, right? And CHG typically has the requirement that shelter not be an option. So for most of our encampment folks, shelter is not an option because they're either banned. Sometimes it's because of mental health, physical health, right? There's reasons that shelter is not necessarily a good fit, different personality dynamics. But just generally, right, the shelters would need to be, are usually the first option, or just getting into housing. So that's kind of where we're going with the hotel program. So it's not necessarily going to be an option for anyone. And HSC is still the place that is referring. We are going to grow, but I don't think the message should be if you're homeless, come to KCR and you'll get a hotel. One, because we need the case management, right? We're still kind of limited, like I was saying earlier, housing search, but also the hotel case management tends to take up a good amount of time. And so we are looking at expanding the team even more, but that's some of our logistical challenges with the hotel. So our main expansion is going to be for encampments, chronically homeless, high barrier, not necessarily folks that are in other categories. And not that we don't want to help those folks. It's just we're trying to reserve other funds, trying to get those folks right into housing as opposed to the hotel. But definitely, if you're in that situation, we're trying to connect with HSC, and HSC will make those decisions kind of based off vulnerability and the slots that we have available. So that's the last kind of plug that I want to. And Kirsten, did you want to talk about the hotels? Did I miss anything?
No, I think you're right on. I think maybe we need to be more specific when we talk about the hotel program, and myself included in that, and just make it really clear it's a hotel program for people who are chronically homeless.
Mm-hmm. Is there like a kind of a bullet point of what chronically homeless is? Like, what is that definition? How do you fall into that criteria?
There is a kind of standardized state and federal definition of chronically homeless. I think in the case of this, and Matt, I'm sure, can rattle it off. It's like you've been homeless for 2 years or had 3 instances of homelessness within sorry, I got that backwards. You've been homeless for a year, or you've had 4 instances of homelessness within the last 2 years. Is that right? 3 years.
Three years, I think.
Yeah. So there is a definition. I think for this chronically homeless hotel voucher program, we have a little more flexibility with that. The exceptions that Matt said, if we have situations where people have been banned from shelters or have behavioral health issues that make them not be able to be successful in shelters, they could be served with this program. But I think a rough definition is people who are currently homeless and have been homeless for a long time.
Gotcha. Thank you for that.
Yeah.
You're going to say something, Matt?
Yeah, and I was going to say is just what Kirsten is like. We are, especially the hotel specific, and that's we have our regular rapid housing program, which sometimes we can use for hotels in certain situations, like I said. And what we're talking about is money now that's specifically eligible for hotels, and that's really just getting started. So that's why it is complicated, because we've kind of got different buckets of money. But and we are still working on some of the policies, in which Kirsten will send. Brenda and I are working on that right now, which I'll send to you once we're done. Kind of an official kind of policy of who we're putting in, or kind of how the screening criteria will work. But it's essentially going to be what we talked about. And then to further confuse everyone, what a lot of people have been confusing with the hotel program is the KEPA side, right? So this is not any of our homeless services. This is eviction prevention. So remember, our TRAP, our KEPA, our ERA, our eviction prevention COVID funds, they can pay for a hotel up for a month for folks that have been displaced. So a lot of folks, that's actually our number one hotel program right now, but that's completely different than the folks that are homeless that are getting served with case management. These are folks that are running through the KEPA program. That was, the wait list and the numbers I just talked to you. And that's actually a much larger kind of hotel right now, kind of by usage, but it's not long-term. It's meant as a bridge for people that don't have anywhere else to go. Ideally, it's a bridge for people to go there while like a new place is getting ready. But in reality, some folks don't have anywhere else to go, and it's just kind of temporary while they figure out what they're going to do. So that's another way kind of hotels are happening that I think folks are, and understandably so. I get a little confused of all the different hotels. So I was hoping to just clarify, and in the short term, say it's not like we're handing hotels out to anyone. It's still a prioritization through Housing Solution Center, and then also it can be an eviction prevention tool if you're getting displaced because of COVID. There's no other option, and you have nowhere else to go. There's a month at the end of it. So that's kind of the broad summary.
And I
sorry
think
if I got too far in the weeds.
Matt's point really highlights why we have a housing solutions center, because somebody who's experiencing a housing crisis doesn't have to understand all these different programs, know which one to apply for, and know like what's available. All they have to go is to the house center, share their situation, and the expert navigators there are going to be able to figure out what is going to meet this person's situation and their need, what they qualify for, what programs are eligible for. So it's meant to take all the hard work and challenge out of somebody who's already having a housing crisis. They just can show up at Housing Solutions Center, give them their information, and then get the resources that they're eligible for.
Absolutely. All right, Jill, what you got for us this week?
Yeah, actually, just to piggyback off one of the things that Kirsten and Matt were talking about. So you said that with the legal people that are going through this legal services, and then they can come and get rental assistance, but it's just a short-term solution. And because the rental assistance only goes for a few months or up to 6 months, right? So then these families that are going to be struggling beyond that, who are in a place, but they are still going to struggle to pay the rent, after that time period is over. Do we have any sense of how many families that is in our county?
I would guess it's probably over 50% of the households that we've served that are going to be somewhat rent burdened after our assistance is done. So,
I mean, what we know is that a lot of households were having a hard time paying the rent before the pandemic. And we have this great sort of emergency short-term eviction prevention assistance that has come in and really helped people stay housed. And in the meantime, rents are now, after the eviction moratorium is off, rents are now going up. So there's going to be even more people having a hard time paying their rent after this temporary assistance ends. So I think it's just highlighting again what a big challenge we have with the gap between people's incomes and the cost of housing. And there's a lot of households that are going to be struggling to be able to get their rent after this temporary assistance goes away.
Yeah. So we talked about this a little bit at the last podcast, but because of that recent sale of that large portfolio, we've been really looking at different preferences that the Housing Authority can put in place. And one of them is a lease in place preference, because as you know, we have close to 600 vouchers we're not even using in our county. And even though we've got a ton of people out shopping, like over 150, there's not even that many rental units on the market. So we're trying to figure out a really good strategy to utilize our vouchers, for people that are rent burdened but do have a place versus a brand new person, whatever they're experiencing homelessness or just, in a unit that's not adequate for them. But I'm just wondering if this should be a bigger discussion among us, because what I don't want to do is put in these preferences and they're not, I want them to be effective to help the most people that we can, but I certainly don't want to go another 3 years not utilizing all of our vouchers.
Yeah, that's an interesting idea. I mean, I think we can come up, I can work with Elizabeth. We have all the data, or maybe Corey too. We have, right, because part of the application process is incomes, and then we also know their rent. So we essentially would know who is over 30% of their income, right? Typically that's affordable, right? All of us know that, but for folks that are watching, it's in our world, in the housing world, it's 30% of your income is typically what's counted as affordable. So we probably, not probably, we could do a little analysis and find out exactly how many folks. I would guess it's at least half, if not more. But it is going to be, like Kirsten said, it's going to be a significant amount. So yeah, Joe, I would love to brainstorm to see if that would be one of the preferences. I know Kirsten, I also would love some homeless preferences as well, but I think it is easier to keep folks in a place at this point than find a new one. And so as far as utilization, I do think that's a good idea for folks that are severely rent burdened, but already in a place and they're already a good tenant. So like the landlord is only evicting them because of rent, right? I think there's a good chunk of folks in that category that would be really a positive way to use to help with utilization for sure.
Okay, so we'll schedule a meeting and try to strategize the best way to do that. But and yeah, we will definitely have a homeless preference, but it's it's a matter of finding a unit.
I know.
So, yeah, it's been difficult. So yeah, so Katie's going to talk about the wait list opening, but I'll just give you a couple updates. One, our office hours are expanding. So starting April 11th, we'll be open Monday, Tuesday, Thursday, and Friday from 9 to 3. And then just wanted to update you that on our emergency housing vouchers, we actually have 16 of the 38 now leased. So it's good. It's been a challenge, but I think Lori, she's downloading the number from the HUD site, and she said we're number 10, the number 10th housing authority now in Washington. So we're proud of ourselves. And then let's see. And then we actually just had, it's good news. We actually just had a meeting with our long-term care facility managers, and there is openings in that facility. So this is assisted living. So you have to qualify for it, but just keep that in the back of your minds that if you know of somebody that's low income and they need to be in an assisted care unit, that there are vacancies in that project right now. And if you want information, you can just get a hold of me or Katie.
All right. Well, you got to get a horn. Folks are trying to applaud you, and you're just steadily doing the work. So you got to stop and smell the roses. Fantastic work as usual, Jill. Definitely appreciate you very much.
Thank you. And
Jill,
Katie,
could you just talk a little bit more about the long-term care facility? Is that one that's owned by BHA or funded by BHA? And how do people get into it? Because we do have a really big issue with, people getting a hospital and not having a place to go that can accommodate their sort of medical needs, but also just people who have pretty severe physical health issues, which our shelters are not, equipped to deal with. What are the qualifications to get in, and how do you get people empty beds?
Yeah, can I send that over to you, because I don't have it all on the top of my head, but they have been really struggling during COVID with vacancies because people were not moving in, and so we're kind of on the end of that. But I think right now they still have like 6 vacancies, so we're just going to try to get the word out. But I'll send you an email with more information, Kirsten.
Can you send us too? Because we're in the same boat. We have some folks with that are a big challenge that really need assisted living or 24-hour care.
Okay, I'll send an email to the manager over there right now and see what information she can.
And Jill, is that assisted living that BHA owns, or how are you affiliated with it?
We own it. Yeah, we own it, but Martha and Mary run it.
Wow, I did not know that BHA owned it. Wow, that's great to know. Thank you. I learned
Yeah,
something.
we have project-based vouchers in there too. So, so yeah, I know I've never heard of a housing authority doing this before. But yeah, so we're really fairly connected there, and it's a great resource. I'm always surprised that they have vacancies.
Jill, we might need to talk more because this is the great challenge that Kirsten knows from Kitsap Connect of like we have folks that can't go, they need assisted living, but all the assisted living that we would try to get them into, they would screen them out either because of substance use or too high barrier or so there was really so the shelters can't take them, right? They can't fully live on their own, but then the typical assisted living facilities all say no, we can't take them, they're too much, and so then we're left dealing with them either homeless, hotel, or or kind of bouncing around between projects. So if you have any influence over this world, I would love to have a conversation.
Well, like I said, we don't run it. So some of those typical things that would keep a person out, it probably will still apply here. But, you know, that's not everyone. So we should, I mean, there should never be
Yeah.
vacancies in a place
No,
like this.
no.
Yeah.
And
So,
building on what Matt said, one of the things that we really need in this county is a long-term care facility that can handle people who have mental health issues also.
Mhm.
yeah.
This is a huge gap in our ability to care for the very, very most vulnerable people. We have people who are living on the street right now because their needs are so high that none of the long-term care facilities can accommodate them, and they have significant behavioral health issues, and it's just the thing that keeps me up at these people who are the most vulnerable, and yet we don't have a way to care for them within our existing sort of support network. And so I just put that out there at every opportunity I can whenever I talk to any legislators or any people with influence or anybody, like really big need, and we need to figure this out because we also know that we have an aging homeless population. And as that population ages, they develop more high physical and memories. And if we don't get ahead of this, we're going to be behind this for a long time. So yeah, anything we can do to help make that happen would be fantastic.
Okay. Yeah, I don't think that this place is that, but I totally agree with you. I just put the website in the chat, so you can go to that website and read more about them.
All right. Katie?
Oh, all right. So we've decided when we're going to open the wait list. We're opening it officially May 16th at 11 a.m. and it's going to be open 24 hours a day until May 20th at 4 p.m. So, and as we've talked many times, we're using this new portal system where you have to sign up for an account, you have to register with an email, and so we're actually going to open registration a month early. So on April 18th, we're going to open registration. And the thing that's really important to understand is when you register for Rent Cafe, you're going to get used to what it means, kind of navigating it a little bit, making an account. And then when the waitlist does open, we'll send an email out letting everybody know that it's open. And then all you have to do is sign into your account and apply for the waitlist. So the biggest thing is if you make an account early between April 18th and May 15th, you won't be able to sign up for the waitlist yet. So you still have to go back in. So just making that clear, but we want everybody to have a chance to make sure their email is all squared away and that they're ready to apply if they want. Again, they don't have to get into the system until that waitlist is open. They can make an account at that time, but we want to give multiple opportunities because we are moving to a date time system. So on May 16th at 11 a.m., it's first come, first serve when you do get to apply. So
if you're already registered in between the time from May 18th to May 15th,
April 18th to May 15th. Yep.
April 18th to May 15th, How does the first come first serve work? Because you're already
You
registered.
still have to log in and apply. So the difference is if you don't pre-register, you'll have to make an account and then apply. If you do pre-register, you have to sign in and apply.
Gotcha. Okay,
Mhm.
that is a huge deal. So, and you can't register before April 18th.
Right now, no, we're still preparing. We want to make sure that everybody's aware before we start getting that information out, and that it is clear that even if you register, you are not on the wait list. You have to wait till May 16th to get on the wait list. So we're giving this opportunity, but it just needs to be clearly communicated that you still have to log back in to apply.
So, as we're encouraging folks to sign up, what kind of information do they need to have when they register?
Just social security number and an email they have access to.
That's it?
Yep.
All right. So that's all you need is your social security number and an email that you have access to. I take it they can call down to BHA and get help with the process if necessary.
That's why we're kind of holding off to publish the link until April 18th. But yes, we'll have people on staff who could help reset passwords or help navigate the platform. We're hoping to kind of get a lot of those questions answered, especially regarding email and having access to email prior to that waitlist opening.
Is that something that you can teach us so our clients, as they come in, you can have them sign up?
I'm hoping that we can use maybe maybe not next podcast, maybe the next podcast. We can talk about it, Marlon.
Okay.
But to do a session where you register on Rent Cafe.
Woo-hoo, I love it.
And we record it and we can share it. So.
I love it. I love it. And, you know, we also have our computer lab over at New Horizon Ministries. So lots of computer access, and KCR has a computer lab. So just trying to make it as accessible as possible. So registration opens April 18th, and the waitlist opens May 16th. So you want to be already registered and ready to go 11 a.m. on May 16th.
Yes, and the best thing is that there are lots. So we are working with the library, making sure our hours match up with their hours. They can only provide so much support, but at least the computers will be available in the libraries at that time during the waitlist opening. But also the computer labs you talked about, KCR, the New Horizons. We have a computer lab at the Bay Vista Summit building. So just getting that information out, but also you don't need a computer. You can do it on a smartphone, which is an easy, very simple process. So.
Absolutely.
And what is the best way for people who don't have access to a computer to get on the?
Or a phone, I would assume, Kirsten, because they can use their phone. Yeah. So you can come into the lobby or call us, and we can walk you through it. If you do get to the library, I think the library is probably the best option, especially between April 18th and May 15th, just to get on there and logged in. And if you do have questions, hopefully we could help in that way. And what I'm going to provide is a handout. It can be published in the community bulletin boards, not necessarily at the computers, but hopefully that we can get information out to help our partners. Also, step 1, do this. Step 2, put your email in. Step 3, and just help with the steps involved in that with handouts, since we all can't be stationed at the different places.
Absolutely. That's big news.
Yeah, so just to recap, if somebody doesn't have access to a computer or phone, the best bet is to get a hold of the paper application and turn it in person to BHA.
There's no paper application, but we could help you if you come visit the building. We could help you. We'll have tablets that we can use to sign you up.
Okay. So go to BHA at 11 a.m. on May 16th.
To get help. Yep. Yeah, we're still figuring it out. Yeah, and we want to make sure to support this work. Doing a date and time is different than what we did before, which was a lottery. So we want to make sure it is still as equitable as possible. That's why we're opening the registration early, but also trying to create those materials, FAQs, and things like that to make sure that everybody still has this opportunity.
When you do register on that day, kind of build on what Kirsten was asking, what information do you need then?
to do the application. It's just household members. You put in your income, but you don't need any verification at the time. Verification and eligibility doesn't get checked until you reach the top of the wait list. So this is just filling in an application with information you already know.
So it sounds like maybe 5 minutes and it's done. Pretty quick.
I would hope so, but it's probably a little bit longer than that, just based on the nature of the questions.
Hey, that's awesome. Well, I'm waiting with bated breath to get the training and to be able to put that information out there. That's a big deal.
Yes, and the more information we have finalized, the more I want to share. So keep looking out for it. Marwan will have conversations hopefully between then that we can get some information out.
Absolutely. Awesome. Well, Kirsten, are you ready?
Well, yes.
The format, how things go.
Yeah.
We're relaxed, we just kind of have dialogue.
No, great. Feels like a nice conversation with a bunch of smart people. So that's really lovely. And good questions too. So I wanted to just really quickly kind of cover what the role of our Housing and Homelessness Division is, because I'm new to this podcast. And so some people tuning in may not really know how what we do fits in with your regular wonderful guests here. So I thought I would talk about that really quickly and then fill in a couple of different things that we're working on. So the Housing and Homelessness Division is part of the Kitsap County Department of Human Services. And our division has 4 primary responsibilities. All of these are legislatively mandated, the state legislature. The first is to do strategic planning around homelessness and affordable housing response. So we work with a bunch of community stakes and have a big community process every 3 or 4 years and develop our county's homeless crisis response and housing plan. And that outlines the goals, strategies, and action steps that our community is going to work on over the next few years to address homelessness and improve the affordable housing situation. We last updated it at the end of 2019, and our next update will take place during 2023. So stay tuned for more information about how that's going to look and opportunities for public input. The second thing we do is act as a grant administrator. The way most of the state and some of the federal funding for homeless and affordable housing programs work is that they contract that money out to county governments in most cases. Occasionally there's a different arrangement, but most of the 39 counties in Washington state, the state contracts with the county government for grant funding that's approved by the state legislature. And they also, sometimes the state legislature makes it possible for local governments to pass additional funding revenue sources for affordable housing and homeless programs. And our division basically is the manager for that funding. So we take that grant funding and we contract it out to a wide variety of nonprofit organizations that are doing the really important work of providing homeless services and homeless housing and affordable housing out to people who need it in our community. So we have right now about 60 different contracts out with subcontractors to provide a wide array of services ranging from outreach teams to homeless shelters, to transitional housing, to recovery housing, to transitional housing, some permanent housing. There's just a huge array of different types of assistance that we contract out for. So we're kind of responsible for making sure that that money gets invested in the best possible way to help people in our community. Then the third thing we're responsible for is collecting data and reporting on what the money is being spent on, how the funding is having a positive impact in our community. So we work with all of our contractors who are doing that really to have targets and outcomes for who they're helping and what the services are they're providing. And then they provide us with information about about what they're doing. Some of that information then gets forwarded up to the state to do our reporting requirements. There are a lot of reporting requirements for any state funding, and we're responsible for making sure that that gets transmitted up to the state. And then the state reports it to the legislature in hopes that they will continue to grant us funding. We also manage the Homeless Management Information System, which is a statewide database that's required by the federal government and the state government. And we work with all of our almost all of our subcontractors to enter into that database information about the people that are receiving assistance. So we have a lot of demographic information about people needing assistance, as well as programmatic information about how long they're staying in programs, what their outcomes are from those programs, and if those programs are at providing the services that we're contracting for. So a lot of data collection. And then we, in addition to reporting to the state, we also put out data summaries. You can look on our county webpage, and there's just all kinds of data summaries, information about veteran homelessness, information about homelessness in North Kitsap and South Kitsap, information about the Housing Solutions Center and how they're doing at, how many people they're serving, on and on and on. A ton of data that we produce for our community and as well as elected leaders. And then the fourth thing that we do is we are in charge of trying to coordinate community efforts. So sometimes that's like a broad coordination level. So we're trying to bring together people to talk about our strategies to address homelessness by working really closely with the Kitsap Housing and Homelessness Coalition. Or sometimes we take on a very specific project, maybe around veteran homelessness or youth homelessness or eviction planning, or trying to coordinate outreach efforts. Whatever it is, we're just trying to make sure that everybody is working together and following the strategies that we've outlined in our homeless crisis response and housing plan. I am super proud of the work that our community done collectively in creating a culture of a lot of collaboration and cooperation between our organs, and always centering the people that we're serving at the very center of what we're doing. It's really easy to get in these situations where organs have some like turf, sense of ownership of turf or control of a situation, of a program or something. And our goal is to really to break down those barriers and focus on how can we all collectively best achieve our shared goals of reducing homelessness and improving access and improving the amount of affordable housing available. So we work really hard at that, and over many years have been really successful at creating a community in Kitsap County of nonprofit providers that really aspire to that level of cooperation and coordination. So that's awesome. So that's the work that we do. We're a relatively small division at the county government level. We're under the Human Services Division. The Housing and Homelessness Division has, we just hired one more staff person. So we have now 6 staff people working on all of these grant administration projects as some specific projects that I'll talk about in just a minute.
Absolutely.
Are there any questions so far, Marwan? Or any questions?
I do. So I love data. Data is really powerful and important. And I know that we skipped the point in time count last year. Do we have the data on that yet for this year?
Yeah, great question. So the point in time count is a federal and state that once a year, all across the country on the 4th Thursday in January, communities do a survey or a count of people who are experiencing homelessness during a 24-hour period. So that's why it's called a point in time, because it's that 24-hour period we're trying to capture that information. And we do this by kind of 2 different methods. We typically have events and locations where we know that people experiencing homelessness will come. So in the past, we've had some services fairs at the Salvation Army and also in Port Orchard and Paulsbo, where we offer a bunch of resources and information, and people will come to us and we survey them for our point in time count. We also survey people at food banks and DSHS offices and just places where people are likely to go. And then we also mobilize a huge group of community volunteers, anywhere between 70 and 100 community volunteers, to go out and walk around the roads and the parks and the woods and the parking lots around Kitsap County and try to find as many people as possible who are willing to take a survey during that 24-hour period. So the point in time count is really important because in addition to the homeless management information system, it's the only way that we really get a good sense of how many people are experiencing unsheltered homelessness who are not seeking services. So I talked about the homeless information system, which is a database of everybody who's accessing homeless services in the county. But if you're not at homeless services, you wouldn't get into that database and we wouldn't have any information. The point in time count is designed to collect information about people who maybe aren't accessing services and who are living in situations where we would consider them to be experiencing homelessness. The point in time count includes both people who are unsheltered that we're collecting those surveys from, and also people who are living in shelters, and we have that information through the home management information system. So the point in time count is supposed to take place every year, but in 2021, we did not do the point in time count because the pandemic was at a peak. In two, there was a lot of question about whether we would do the point in time count because if you remember, Omicron was surging at the end of January and everybody was very concerned about whether we would be able to do a very good job counting people and how to keep everybody safe. So the state applied for a waiver from the federal government to do our point in time count a month later. So in 2022, we did our point in time count at the end of February instead of at the end of January. And so it was a little bit different than we've done in prior years because it was at a different time. We also didn't do our big services fair. Our Project Connect fairs didn't happen because there was too much concern about people gathering inside and offering resources and having a bunch of people who were very vulnerable in a small enclosed spaces. So we didn't have services fairs. So our methodology was a bit different from prior years as well. So we've got all of the data that was collected from those surveys that were collected, entered in, we're getting that into a big database, and we're right now in the process of unduplicating it. So what that means is that we're trying to find out, did we accidentally get surveys from the same person? And if so, we can only count them one time. So that is a pretty laborious process, and we're wrapping up that. As soon as that's done, then we will have some preliminary data to be able to release to the public about what our numbers were. And we also send that data to the state. And the state then takes all of our data and all the data from all the other counties around the state and unduplicates it again on the off chance that maybe somebody got counted twice in two different counties. Like, it's pretty rare, but every once in a while that might happen. So then the state unduplicates it, certifies our numbers and says, okay, here's your official number. And sometimes it goes up one or two, sometimes it goes down one or two. Then they certify our numbers, and then they send all of that information to the federal government, and the federal government then turns around and produces these massive, like, countrywide reports. So that's the very, very, very long answer to your question, Marwan. But the short answer is we hope to have the preliminary point in time count data available in the next week or so, and we will be putting out a data summary and putting it on our website and making that available.
No, I appreciate the long explanation because everyone doesn't know what that is. You mentioned something in there. If they don't want to participate in the survey, do you still count them? Like, how do you annotate that, or do you?
Yeah, really good question there. So the survey is, we often say that the survey is limited by the number of people we find and the people who are willing to take our survey, right? We don't force anybody to take our survey. What we can do, we can, if we're able to collect enough information about a person visually, and we can have enough information to make sure we didn't count them twice, then we can include them in the survey results. So for example, if we saw a person, one of our survey teams was out tromping around in the woods and they saw a person who was sitting outside of a tent and they asked if they'd be willing to take our survey and the person said no, then the surveyor would say, great, thank you, appreciate it. And they would step away, but they could note down the approximate age, gender, and location of that person and submit that as part of the survey. When that survey form comes in, our data people will look at it and say, is there any other information that looks like that accidentally be a duplicate? Like if they collected that information at say 9 a.m. in Paulsbo, there was a 50 to 60-year-old woman in Paulsbo in this location, we would know that that could not be the same person as a 50 or 60-year-old woman at 9:30 in the morning in Port Orchard. So we would be able to count that as two different people. But if there's any question about it accidentally might possibly being the same person filling out a survey twice, we would have to only be able to count. We'd only be able to count them one time.
Final question, and I want to open it up to the rest of the panel to ask a question. Is there any historic guesstimates on all the people that aren't captured, right? Because it's just a point in time, so you're undoubtedly going to miss people. So is that number 10%, above that, 20%? Like how much do we have any kind of estimates there?
Yeah, it's hard to know, but what I've heard other communities and the state use as an estimate is 2 to 3 times is the actual number. So if we counted 50 people, the actual number would be 150. What is that? Two times would be 100, 3 times would be 150. So that's kind of the rough estimate. We often use like 1.5 as a multiplier just to kind of split the difference. So for example, in 2020, we found that there was 199 people living unsheltered during our 24-hour period. We would consider that maybe the real number was around 500, 2.5 times. Now that's only during that 24-hour period, right? That doesn't, most of us don't think about homelessness like that's like at a time, right? But there's always people, hopefully, who are moving into permanent, stable, dignified housing, and more people who are displaced. So there's kind of a constant flow in and out. So it's an important number, but it's not a super accurate number because of the undercount and because it's only a snapshot at this particular moment. It's reflecting how many people, like over the course of a year or a course of a month, might need assistance.
Gotcha.
Anybody else have a perspective on the multiplier or how to better gauge our actual population?
I mean, some of the research I've seen on that, Kirsten, confirms what you're saying, but they think, and some depending on the region, they think it can be up to 10 times. So I've heard estimates of like 3 to 10 times what you count. Now that varies, right? Like, so, Seattle, is a bigger area, right? But they also have a little more methodical because they go street by street. We don't have near the volunteers to go street by street, right? So ours might be a little higher because it's hard to search every encampment that's in the woods, right? Like we have a lot of areas that are hidden, so ours might be a little more on the higher side compared to some communities, but it can be a big range of undercounting. But I think what everyone agrees, to your point, Kirsten, is that it's an undercount. It's the degree is which up for debate.
So I often characterize it as the minimum number of people. Like our point in time count is the very minimum number of people that we know are unsheltered at that time.
And I had just a question. So the reason for it, I would, just from my understanding, is it's a HUD initiative, and it's a lot of how they base this number is, is how funding is based. So they use numbers like this and how we collect data for basing their amount of funding they're providing to different counties and states.
That is true. That is my understanding as well. The unfortunate thing about that is that different communities have different ability to do it differently, and it's a very imperfect methodology. And even for us in Kitsap County, whenever anytime, so we typically, they're like, people want to know, like, well, how was your point in time count different than a year ago or 2 years ago or 3 years ago, right? And even HUD looks at, like, what was the change in the number of unsheltered people during your point in time count, right? But this year we have to put a little asterisk next to it. Everybody does, and say, we're in the middle of a global pandemic. We could not do it the same way that we did it every other year. And so it makes it, we had to do a different methodology. We didn't do it exactly the same way. So it feels like, if anything, even more of an inaccurate count this year than in past years, because we had a pretty good methodology. We were really working hard to stay consistent with it. And then, like everything, couldn't do it the same this year. So I'm hoping that HUD will be a little bit more understanding of that this time, because it was true for everybody across the country. We were all in the same pandemic influenced boat, and had to do things a little differently.
So Kirsten, do you have a sense, just from the numbers, if because you weren't able to hold those large resource fairs where people came to you, that really made the undercounting of people?
I think so. I think we, if my recollection is right, we would often get more than half of our surveys for unsheltered people at those fairs. And so without having that as a way to attract people to take surveys, I think we definitely are going to see an even bigger undercount. This year, we also struggled to have enough volunteers. Volunteerism was way down, and I think we did a really valiant job with the smaller number of volunteers that we had. I don't feel like we had any big areas that weren't covered, or we missed a lot, but there were some situations where we just couldn't go everywhere because we just didn't have the numbers of people to do it. So both of those things were impacted by the pandemic, or caused by the pandemic, and will have a potentially big influence.
And definitely shout out to Northwest Hospitality for their work in the point in time count.
Yes, thank you. I meant to mention that the other thing that we did differently at the county this year is that in the past, our county staff has done all of the volunteer coordination. And this year we realized that with all of the new grant funding that we were managing, we just didn't have the capacity anymore. So we contracted with Northwest Hospitality to do our volunteer recruitment and do a significant amount of the volunteer organization. And they did a great job doing it. And so that was another change in methodology, but also a really super helpful, useful way to do it, so that we could do it as best we could with the different numbers of volunteers. They really did a great job getting the word out and recruiting and training and all that. So that was definitely a big shout out to Northwest Hospitality for their work on that.
I appreciate everyone staying on a little longer, as it is Kirsten's first show.
Oh, sorry, did I go over time?
No, you're perfect. You're just perfect. This is the thing, right? Is accessibility, getting the information out there, and different avenues and formats, so more people can digest it and can learn from the experiences. And you guys are learning from each other, on the podcast. So I think it's this is the purpose of this, and I think it's successful. So please take all the time you need. People can drop off when they have to, but I know you said you had a couple other things that you wanted to cover.
Yeah, I just wanted to talk a little bit. I'll edit a little bit here for time.
And there's always next Wednesday.
Well, I am very happy to come back. I cannot come back next Wednesday because there is a big conference in Seattle on Housing First that I'll be attending. So I won't be able to be next Wednesday, but I will come another time for sure. Love to be back. I did want to talk a little bit about a program that has gotten some press called, the commissioners approved an additional small amount of sales tax, about 1/10% sales tax. It's estimated to cost the average person like $17, $16 a year or something. So all impact on most people's pocketbooks, but collectively a very big impact. This is a small amount of sales dedicated to providing funding for more affordable housing. And that funding we're combining with another source that we anticipate will generate between $5 and $6 million a year, which we have out for competitive applications for development of new affordable housing and behavioral health facilities. So that program is being called the Community Investments in Affordable Housing, or CIA, CIAH, Community Investment in Affordable Housing. And we're just in the process of developing the program and putting together kind of the way that funding will get prioritized and distributed. It will be through a competitive process with citizen committee advisory group or community advisory group, similar to 1% for behavioral health awards, or 1/10 funding, which a lot of organizations in the community have used for behavioral health programs. So we're modeling that program, the CIA program, after that 1/10 behavioral health program. There's a lot more information to come. We're just really literally in the early stages. The sales just began to be collected this week on April 1st. So lots more information to come about that. We anticipate it will generate between $5 and $6 million a year. And, we will have our first distribution through a competitive process in 2023. So I'm just trying to answer questions about that program to the best of our ability with the limited information that we have developed so far. And there will be a lot more information coming out as we get closer to actually having a competitive cycle for distribution. What we're hoping is that we'll be flooded with applications for new affordable housing development, and that will generate a huge number of new units of affordable housing being developed in the county. Eligible organizations would be nonprofits, housing authorities. I think even for-profit developers could apply if they were developing affordable housing.
Is there a way to put a little bit more pressure on developers that come in and say, hey, we're going to make 20% of these units affordable? And I mean, even at best case, you have 100 units, it's only 20 units. And so it's such a small, pebble in the ocean of trying to address the crisis. Is there a way to kind of flip that and say, hey, 80% need to be affordable?
We could have a really long conversation about this. I'm not trying to deter the conversation, but I'm just wondering if maybe that would be a great topic for a future podcast to kind of dive into that a little bit more deeply, because it's pretty complex. There are some incentives for developers. There are some coming changes in requirements. So definitely a lot to dive into there. Yeah, I'm sure Jill would have a lot to say about that.
Around to that one. Yeah, no, that's a big one. People don't understand that, right? They just hear, hey, 20% of these units are affordable, and it's like, but there's all this need out here. So, we don't understand. So yeah, that would be awesome.
Yeah, and we could even get some other people who have good information about this to weigh in as well. But it definitely warrants a lot of information sharing because it is a complex topic, and there's a lot of different perspectives on it. So we would want to have a good chunk to fully explore it, I think.
I'll push that for somewhere around the end of May. We can start organizing.
Perfect.
Yeah. And then you had a few more?
You know what? I think I'll leave it there for right now. I mean, Matt talked a lot about the KEPA program, which is one of the big programs that we're funding. I don't have the latest tally with the latest reimbursement requests from KCR and the two housing authorities. They're doing the distribution of the funding as well as Coffee Oasis. But I would venture to say there's still quite a bit more money available in the pipeline. So maybe they've spent $17-18 million. I think we probably have at least another $20 to $30 million available over the year or so. So I just would urge people to not get discouraged, to still submit applications, and hang in there while KCR and the housing authorities are working really hard to get those applications processed.
And just hearing that, thinking about the reported numbers from Matt, 1.3 million per month up to 2 million, maybe a good 10 months of funding still in the pot.
Yep.
That sounds
That's what
good.
we're anticipating. Yep.
Good.
And
then see, the numbers are important.
Yeah, the numbers are important. And then obviously a big shout out to our outreach organization partners, of which the Gather Together, Grow Together is one. We've got a lot of great partner organizations who are doing work reaching out corners of the county where people might not find out about the KEPA program, and making sure that they have access to the applications and have the information they need to make good applications. So I know you guys have talked about that in the past. I just always have to say a big thank you. We could not do this without all of our partner organizations. This is a tremendous amount of work and a huge lift. And it's really been wonderful to see how many different organizations have stepped up to take on additional roles and responsibilities and do a little bit more to help our community.
Well, we appreciate you too. And to that end, our application has been approved. We're just working out the details on how the conduit is going to air on BCAT, so our reach will be even further in the county. So stay tuned.
Wonderful. Yeah, that's great news.
All right, guys, you can see this was a fantastic show, jam-packed, full of information. We're growing. This is what this is supposed to look like, right? This is the coming together, doing the work. We can't do it alone. We need the hearts of the people and organizations. Yes, absolutely. Easy one, easy button, boom. Let's just make sure that one is the big breakfast, because that's definitely don't want you to miss that, Kirsten. But again, I want to thank the Bremerton Housing Authority, KCR, and of course the county, Matt Garrett, Jill Stanton, Katie Sharp, Kirsten Jewell. Thank you so much for coming on, your dedication to this. You're so very busy, but you carve out this time to come on and share with the folks. So we very much appreciate you and all of your efforts, and just to continued partnership and collaboration in trying to solve, the issues that exist here in our county. Anyone want the last word? All right, I think that says it all. We will be back tomorrow, so stay tuned. I'm R1 Cameron. This is The Conduit. Thank you so much, everyone. We'll see you next time.